uh, camera.
Get off.
A very good afternoon to respected dignitaries, governing body, members of RAV, Director RAV, Dr. Vandana Siroha ma'am, Gurujans. I welcome you all in another intellectual session of Gyan Ganga webinar series. Today's guest speaker is Professor Dr. S.N.Suresh, Senior Consultant, Sri Venkataramana Vaidyasalai, Karur, who has joined us today in the 247th episode of this knowledge voyage. I, Dr. Himanshu, on the behalf of RAV, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Vedeshri Devendra Trigunaji, President GBRAV, respected Vedeshri Rajesh Kotecha sir, Secretary Ministry of Ayush, respected Dr. Vandana Siroha ma'am, Director RAB. Let us begin the session by seeking the blessings of Lord Dhanvantri. Now, I would like to introduce today's expert, Professor Dr. S.N. Suresh sir, who is going to throw light on the topic Ayurvedic clinical approach to a few gynecological disorders. It is my proud privilege to introduce Dr. S.N. Suresh sir, an eminent Ayurveda physician and academician per excellence. Dr. S.N. Suresh sir holds a BMS degree from Bharatiyar University, where he was a rank holder, and completed his MD in Ayurveda from University of Kerala with over 28 years of rich clinical experience and more than 22 years of dedicated to teaching. He has made remarkable contributions to the field of Ayurveda. He serves as professor of Ayurveda and has held a prestigious position as chairman in board of studies and senate member at Tamil Nadu, Dr. M.G.R. Medical University. He is also the chief consultant at Sri Venkataramana Vaidyasalai, reputed 80 plus year old institution equipped with Panchkarma and manufacturing units. His areas of expertise include Prasuti Tantra, research in Shar Karma, classical Gurukul training, and he has been honored with multiple national and international awards for his scholarly contributions. Now, I would like to invite Sir to proceed with the lecture. Before we start, I request you all to please switch off your mics and cameras. Please, sir.
Good afternoon, everybody. Am I audible? Okay.
Yes, sir, audible.
Saluting to the lotus feet of my Sri Guru, Sri Vasudevan sir, my Paramaguru, Sri Pumuli Nambudipad, Tamburan, and my beloved guide, Professor B. Shamala. At the outset, I thank RAV for giving me this opportunity to be before you. I thank Vaidya Devendra Trigunaji and Vandana Shiroha ma'am for making this possible for me to be before you. Okay. With that, let us get into the program. As you all know, there are 8 branches of treatment in Ayurveda. It's not branches of Ayurveda, it is the branches of treatment. Chikilsa, Esha Samsrita. They are Kaya Chikilsa, Bala Chikilsa, Griha Chikilsa, Urdvanga, Shalya, Visha, Rasayana, Dvajikarana, etc. Though the basic principles are mentioned in the Kaya Chikilsa itself, there are some special concepts and priorities and points to be remembered while treating in other specialities. As for Bala Chikilsa, you have to have an eye on posology, the nature of drugs to be used for the bala, etc. We cannot give Tikshna drugs, etc. And Deva Vyapashraya treatments in Graha Chikitsa, and Sthanika and Indriya Vishesha treatments in Shalakya, and surgical techniques in Shalya Tantra. As far as Sri Roga is concerned, so such special managements is not needed. Instead, its principles lie partly in Kaya Chikitsa, Bala Chikitsa, and Shalya Chikitsa. Hence, Prasuti Tantra and Sri Roga was not designated as a separate branch of treatment or included in the branch of treatment or as a separate speciality in the Shastras. Whereas, owing to the importance of women in the society, the speciality Prasuti Tantra and Stri Roga was designated by Gananath Sen. So, the treatment principles mentioned in Kaya Chikitsa, Bala Chikitsa are to be adapted as necessary and warranted in this treatment of Stri Roga, which has to be kept in mind. And these references are all scattered throughout the text. It is not confined only to a particular area. They are scattered throughout the text, right from your Sutra Sthana, Sharira Sthana to the Uttara Chikitsa and Uttara Sthanas. Stri Rogas, and another thing we have to keep in mind is Stri Rogas, especially Yoni Vyapats, are mentioned in the later chapters of Chikitsa Sthana. So it is a sampradaya of the Shastra in the book. You have to study the Shastra in the order. The order is very important. Why that order is very important is the principles which were told in the earlier chapters will not be repeated in the later chapters. For example, if you take Jwara Chikitsa, there they will give you an exhaustive explanation of how Amapachana has to be done, in which condition, what has to be done, everything in detail about the Amapachana. Whereas when the later chapters come, they give a glimpse that you have to do the Amapachana with this drugs like that. They mention and go off. But it doesn't mean you will not get a full information when you look into that particular chapter, unless and otherwise you have a knowledge of the earlier chapters. So your knowledge will be complete and it will be practical only when you have the knowledge of earlier chapters and adapt the treatment and principles which are told in the earlier chapters. You have to adapt according to the need. So as all the treatment principles are told, there will be just a mention of relevant preparations alone, so that the line of treatment has to be adapted from the earlier chapters. Because when you see the 30th chapter, they will say Rakta Pitta Karayana, about the Rakta Yoni will be saying that at the end. They will not be, they will be mentioning a couple of preparations only. So it doesn't mean this with that principle only, if you with that drug only, if you're going, of course the drug is useful, but it alone will not be sufficient to manage that. But all the principles has to be treated from the earlier chapter of Rakta Pitta. That's what we are going to see in this uh, uh, lecture. How we have to do that is the ultimate aim of this lecture. So before we go into the treatment, we have to know the skeleton of the treatment principle. So this is very well explained in the, we can understand very well in the, when you study the Jwara properly. Because if you know, if you study Jwara, the Guru used to say, if you study Jwara properly, you will be able to treat most of the diseases. Because all the treatment, all the treatment methodologies, all the concepts are mentioned exhaustively in Jwara. So you have to, so there you will get that skeleton of the principle of the treatment. Let us see what is that. So in the first stage, when there is a Utklishta dosha, you have to go in for a Shodhana. They say, Tatra Utklishte Samutklishte Kapapraye Chale Male Sahrillasa Praseka Annadvesha Kasa Vishuchike Sadhyo Bhuktasya Sanjate Jware Same Visheshataha Vamanam Vamanarhasya Shastam. So in this, see, if you take the initial part of the jara, when there is the doshas are already utklishta, they will be advising a shodhana procedure. The purpose of Shodhana procedure is to remove the already Utklishta dosha. Usually we don't do Shodhana in Ama, but here it is Ama. Jare Same Visheshataha they say. Even though it is Ama, why are we doing this Shodhana? The purpose of Shodhana is remove the Utklishta dosha. So here a doubt arises whether we have to get Sneha Svedana. No, it is not. It is not necessary. The purpose of Sneha Sveda is to produce Utklesha. As already the doshas are Utklishta here, there is no fun in going for a Snehana and Sveda. In fact, doing Snehana in such a condition will be very harmful. So you have to go in for a Shodhana procedure initially. This you can see in every disease. They will be mentioning about a Shodhana procedure, whether it may be a Gulma, whether it may be a Shvasa, the Kasa, every disease they will be mentioning a Shodhana procedure in the initial stages at the beginning of the treatment itself. And the purpose of that is to remove your Utklishta dosha. And once the Utklishta dosha is removed, then it comes to the Amapachana. So now we have Ama associated with the Samprapti. You have to go in for a Amapachana. Here Ayurveda has got a unique method of treating the Amapachana because it has got two parts. One, the rogi will be weak and will be weak and he is afflicted with the disease. Weak means his Agnibala will be less. So we give food which is medicated. That medicated food has got two parts. One part is ahara, that is peya, vilepi, etc. And the second part is aushada. So when you combine both, what is advantages? So the ahara part depends upon the agni of the patient, whereas the aushada part depends upon the samprapti of the disease. For example, so if the Agnibala is less, this you can very well appreciate in the Jara itself. When the Agnibala is less, they ask you to advise Mandapurva Biraditaha, Peya, ask to give you a Peya, which is medicated, with the start with Manda, which is the supernatant part of the Peya. So you start with that, and then gradually you go to, they say, Kuryat Peyaushadai Reva Rasa Yushadikan Api. That is the same drug. You can use it for making Rasa, Yushas, etc. So the drug medicament part is meant for the Samprapti Vigatana, whereas the Ahara part depends upon the Agni of the Bala. As the Agni increases, the Gaurava of the Ahara part will be increasing. So you start with that's what we do in the Peyadikrama. Peya, then you go in for Vilepi, Agritarasam, etc. So that will be depending upon the Agni Bala of the patient. And this medicament part, you have to first you start with the Peya medicated with a particular drug, then you go in for the Vilepi if the Agni Bala increases, like that it will be increased based on the Agni Bala of the patient. So this is a unique concept, giving food itself as a medicine. Then once the Amapachana has occurred, then next stage comes, you have to go in for Shamana. This is advised with that of Kashayapana. Tata pakveshu dosheshu langanaddesh prashasyate kashayo doshasheshasya pachano shamano eta. That you have to do the Shamana with that of the respective kashaya told in that particular part. And once the Samprapti Vigatana has occurred and the doshas are pakwa and has been stabilized, then you have to stabilize the ashaya, and then they advise you to go in for a snehana, especially grita, so to stabilize so that to prevent the punaravartani of the jara. That is kashaya panna patyana dashaha iti lingite sarpihi dadyat kape mande vatapittottare jare Pakveshu dosheshu amritam tad vishopama manyata. That is, once the dosha has been completely pakwa and the samprati has been, so vigatana has been done, you can see many people like the Ritam, etc. mentioned in the Jara. So they are administered so that the jara does not come back again. So this is first set of management, and after that also, if the disease still persists, then what you have to do is, because what happens is you have removed all the doshas, you have treated the samprapti, but when the doshas are very leana in the dhatus, it will not, this will be producing the jara once again, the jara or whatever disease once again. So in that condition only, you have to go in for Snehabana, Svedana and Shodhana procedures. So this Snehabana, this for this Shodhana procedure, you have to go in for the Snehana and Svedana. Why? Because the doshas are leena, and without doing that, you should not go in for the Shodhana procedures. And after the Shodhana procedure is over, then you have to go in for the Shamana, and there are different conditions that comes according to the disease, etc. And then comes a very important point. Then if at all the jara persists in the localized sthana, if it is in the eyes, you have to go in for netra tarpanas. If it is in the nose, you have to go in for nasya. If it is in the skin, you have to go in for abhyanga, like that. So even though after the shamana, if the whole body samprati is has been taken care of, if the disease persists in a particular part of the body, localized part, the treatment procedures has to be done to mitigate that. That is sthanika dosha chikitsa. So here it is very clear that you have to go in for a sthanika dosha chikitsa after doing the sarva deha dosha chikitsa, or like shodhana. Why we have to you have to insist on that is, if not, if you do the sthanika chikitsa before treat, for example in the jara, if the jara is in the skin, if you do abhyanga, etc., that will not go, because once, even though it mitigates a little of the doshas, little of the jara, but since there is jara in the whole body, that will be contributing for the disease. So if so, whatever sthanika chikitsa you do, it has to be done after proper cleansing or treatment of the whole body whole body vitiation. Then only you have to go in for the sthanika chikitsa. This is very, very important. That's why we have explained all these things. So uh, before getting into the treatment of a sthanika dosha, see that there is no contribution from the whole body to that sthana. So with that, let us have a glimpse of what is the Samanya Chikitsa Siddhanta. Sarvam Vyapanna Yonintu Karmabi, that's what they are mentioning. Sarvam Vyapanna Yonintu Karmabihi Vamanadibihi Mridibihi Panchabihi Narihi Snigdasvinnam Upacharet. So that's why they have said you have to go, even though it is Yoni Vyapat, they are explaining about the karma bihi, vamana bihi, all the shodhana karmas has to be done. But it has to be done in the mridubihi. Why? There are two reasons why it is mridubihi. One, the yoni vyapat can occur only to a woman who is mrudu. And the second thing is the dosha vitiation will not be so strong as in that, like that of kushta, visarpa, etc., which warrants a repeated shodhana procedure. Usually it is in the Vatasthana. So usually there need not be it will not warrant a stronger Shodhana karmas, like Vamana, Virechana, etc. That's why they specifically told Mridubihi Panchabihi Narin Snigdasvinnam Upachare. Sarvatasya Vishuddha. This is what is a catching point. Sarvataha sa Vishuddhayaha Shesham Karma Vidiyate. Because if you don't do that and go in for the localized Yoni Vyapat treatment, it will not be successful, because there will be a contribution from the whole body. And Escha Vigata Vikaranam Tascha Karmoktan Tascha Karayet Sarvam Vyapatsu Matiman Mahayonyam Visheshata. And second point you have to keep in mind while treating the Yoni Vyapatis, Nahi Vatadrite Yonim Narinam Sampradushyati. That is, Vata is the Sthanika dosha, and whatever disease occur, there will be an influence of Vata in that, In other words, whatever treatment you do, it should not vitiate or increase the vata. Or in other words, we can understand that whatever medicines that are told in the Yoni Vyapat Prakarana in the concerned chapters, it will not increase the vata. So those things you can use it in other diseases also. So we say our treatment is not like a confined compartment. We use preparations from Jara for Gulma, Gulma for Arshasa, treatments or medicines told in Gulma for Sri Roga, etc. Everything will be, because what we need is what happens. What is the samprati that occurs whenever there is a similar samprati in any other disease? We can take that medicine, that that medicine and that principle here also. That's why we take the principles from Jora, we take the Amapachana concepts from Jora, we take the Amapachana medicines from Jora in for Kushta, Visarpa, everything. For all the diseases, even we adapt the Amapachana basics from the Jora. So, what the second point we have to keep in mind is Nahi Vata Dhrite Yon, the Sanika dosha is Vata. And of course, these are all the treatment principles. And the third thing they are explaining from where and all you can get to the reference for treating the Yoni Vyapat. Pratidosham tu sadhyashu snehadi krameshe dadyat uttaravastim cha visheshena yatoditam. Because uttaravasti plays a very important role in the treatment of Yoni Vyapat or the Sri Roga. Why? Because it acts directly on that sthana. And Shukrartavadayo doshaha stanaroga Shukrartavadayo doshaha stanarogasya kirtita klaibyasthanani moodasya garbhasya vidirevacha Garbini pratirogeshu chikilsa chapyudahrita sarvatam tam prayunjita yoni vyapatsu matiman buddhiman. That is, you have to go in for the treatment principles which are told in these chapters also are to be adapted while treating the yoni vyapat or Sri Roga. So these are all the things you have to keep in mind before getting into the treatment process or treatment of Yoni Vyapat. Hello. No, we are. I think someone has unmuted. Kindly mute, sir. So we are going to deal with basically 6 disorders in this. So for hello, we are going to deal with basically 6 disorders because Vata has got 2 types of dushti. One is Swaguna Vriddhi and other one is Gati Vaishamya. That is, for Swaguna Vriddhi, we are going to deal with the Shushka Yoni Vyapat. For Gati Vaishamya, we are going to deal with the Udavartini Yoni Vyapat. And similarly, for Artava Apravritti, we are going to deal with Arajaska. For Atipravritti, we will be dealing with Asraja. And similarly, for Kapha, we will be dealing with Upaplata, and for Ashraya Vichyuti, we will be dealing with Mahayoni. These are all the 6 basic major diseases we will be discussing now in this lecture. Of course, Shushka is a disease where Vyavaya Kale, this and all you have studied, so just give a glimpse of it. I'll highlight what are the treatment points you keep in mind. Vyavaya Kale Rudantya Vegan Prakavito Nilaha Kuryat Vinmutra Sangarti Shosham Yonimukasyacha. So what happens here is there will be a dryness occurring in those areas, and it will be associated with Vinmutra Sanga. That is the improper flow of urine and stools will be there, and it produces the dryness in the Yonimukha, which this is a common presentation you get in your day-to-day practice. Shosham Yonimukha Ityanena Yonimukha Soshat Sushka iti Samyam Vyakrita Bhavati. Then when you look into the this thing, when you look into the text, there will be given only thing, Vatahara Chikitsa has to be adapted, and Uttaravasti with Jeevaniyagana Siddhataila is advocated. But when you get into the practical, so as you know, it is the increase in the soguna of the vata. We have to see whether it is a sarvanga vatakopa or a ekanga vatakopa. This is very important. If it is associated with sarvanga vatakopa, you have to treat in the line of treating vata vyadi, like snehana, vidyanantrakritam, kalyanakritam, etc. And svedana, abhyanga, and vastis are to be advocated accordingly. And clinically, we get an interesting, in Rasakshaya also, we have seen many cases having this, presenting with the Shushkata in the yoni. So if it is associated with, because Rasaya Rokshan Samas Shosho, isn't it? So we can see in many cases, we can even Rasakshaya can produce the Shosha in the yoni. And if it is due to Rasakshaya, initially you have to do with Deepanapachana and then go in for Brahmana treatments. So there, if you do direct Brahmana, it will not be beneficial. You have to initially start with your Deepanapachanam and go in for the Brahmana treatments. And if it is confined to yoni, you have to focus more on the Sthanika Chikitsa. You go in for Sukumara Kritam, Vidaryadikritam, Palasarpis, etc. And so you can give it a Sadhya Snehapana or Achapana, and depending upon the intensity of the Rokshatva. And Pichu with Vidaryadikritam, these are all the effective practices which we did in our clinics. Pichu with Vidaryadikrita and Palasarpis will be very effective. And Uttaravasti with Dhanantra Tailam or Rasa Tailam is also beneficial. So here also you have to see the just increasing the just doing a Brahmana Chikitsa will be beneficial. But before that you have to see whether it is Sarvangaka or Sthanika, and whether it is Rasakshayaja is to be kept in mind. Then you have to proceed for the Brahmana treatment. The next disease is Udavartani. So here what happens is Udavartana, Vega Udavartanat yonim, Udavartayate anilaha, Sarugartha, Rajakristena munchati, Udavrittam munchati, Artavasa vimuktetu, Takshanam labate sukam, Rajasa gamanat urdam, Neyo Udavartini budaihi. So what happens is Vega Udavartanat, by controlling the natural urges, what happens is the gati of vata is reversed. So what happens is the vata is coming, apana vayu, which is supposed to go through the adhomarga, the direction of vata is reversed. So what will happen is there occurs a tug of war between the udavrita vata and the normal vata which tries to push it up. So when there is a tug of war begins, naturally the strength of the both the vata will increase, which naturally when that tug of war will result in a pain in the pain in that part. But once the natural vata supersedes and pushes the artava out, once it succeeds to push out the artava, what will happen is artava sa vimukteta. Once that artava flows out, once the natural apanavayu supersedes the vikrita apanavayu and pushes the artava out, what will happen is when there is a blood flow, the blood flow out, then takshanam labate shugam. She will be relieved for certain time because there is no vata to counteract the normal vata. But what happens is after some time again, since the samprati is established, again the vata will start coming gradually increasing. Then again the tug of war comes out, and when the so again this process repeated. So that's why they say artavasa vimuktetu labat takshanam labate sukam. Rajasa gamanat urdam eyo udavartini budaihi. So yonim udavritam means it is urdam nita. The gati of vata is altered. The gati of vata is reversed in this disease. So what they say, sa pidita sati udavritam baddam baddam madhye madhye urdham avartamanam visujati, says Hindu. That is, the flow will be little by little. With pain, there will be pain, there will be flow. He will be relieved for some time. Again, there will be pain, there will be flow. She will be relieved. That is, intermittently she will have the pain in that. So in this disease, is the gati of vayu is changed. What you have to focus is on the anulomana of the vata. So the shushka we treat for the soguna vriddhi of the vata. What here we have to focus is in the anulomana or gati of the vata, vata loma or anulomaka. And here what you have to keep is, here the pain occurs during the Vega Kala alone, which is during the menstrual period. So since this disease, the pain occur during the menstrual period alone, you have to, just like Apasmara, you have to divide the treatment into two parts. The interventional period has to be divided into two parts. One is intermenstrual period and perimenstrual period. First, you have to, in this also, you have to classify whether it is associated with Sarva Sharira Vyapata condition or it is only Sthanika. So, Sarva Sharira Vyapata can occur in conditions as Arshas, Udavarta, and Udavarta refers to the disease Udavarta, which is explained in the Arshas and various contexts by different acharyas. In all these conditions, what happens is the gati of vata is reversed. So if the Udavartini Yoni Vyapat occurs as a sequelae to Arshas, it has to be treated properly. So if it is due to the Udavrita, the disease Udavrita, what you have to do is you have to go in the intermenstrual period. You have to go in for treatments told for Udavrita as Varti, as Nirukhavasti, Snehavasti, Snehavirachanam, and Aushadas as Panchajiraka Guda will be giving, and Danatra Gulika, etc. With those things, you first, during the intermenstrual period, you treat for this Udavrita Vata and then treat for Udavrita during the perimenstrual period. And if it is due to the arshas, the treatment of arshas has to be done. And similarly, if it is due to, so in practice, we use Chiruvilva Kashaya and Gandharvastadi Kashaya, etc. if it is associated with arshas and Agnimandya. So generally, in many cases of arshas, we can get simultaneously this symptom also. So in those cases, we treat we treat the arshas properly during the intermenstrual period, and during the perimenstrual period, you have to go in specifically for the preparations told for that. Otherwise, then only the repetition of the recurrence of the disease will be stopped. Otherwise, she will be suffering in every period. She will be suffering continuously. And similarly, you can very interestingly, we have seen in Shwasa also we are getting this conditions, because when selling the Samprapti of Shwasa, Adapradhihato Vayuhu Rajatyurdam Hridashraya. So in Shwasa also, the interesting part in Shwasa, treatment of Shwasa is, it is also two-phased. Initially, you have to treat for the kapha, which is the Sthanika dosha, and after that, the treatment will be complete one, unless and otherwise you go in for the vata anulomana, otherwise there will be the repetition of the shwasa will occur. So because the disease occurs due to it's basically a vata vikara, that's why in the samprati they say adapradhihato vayu. And in those cases also, the woman with shwasa can also have uh, uh, Udavartini Yoni Vyapat. If it is associated with that, we can go in. If it is associated the Kashayam or the we have to or Balaji Rakadi, whatever Kashaya it is in. So which produces Vata Anulomaka. So these are all the common conditions we get. Even though it manifests as Udavartini Yonivyapet, it usually is associated with many diseases of the whole body. So after that, we use for Snehana we use Sukumara Grutam as Sadhya Sneha, Snehapana, and for Virechana we use Eranda Sukumara, or Gandharastadi castor oil or Hingutragana Tailam, etc. And for Snehavasti, we use Dhanvantara Tailam or Pipalyadi Tailam. And for Abhyanga, we use Bara Tailam, Sahasradi Tailam, etc. And if the woman is very weak, see, this is an interesting condition also. If the woman is very weak, she may develop, even though the pain the pain shamatha will be less. So in that cases, just by increasing her strength, in many cases we get nowadays, because most of the women they don't take proper food in the morning. They skip the breakfast very easily. So in those cases, just by doing the Brahmana and just a simple Vatana Lomaka will have an excellent result. During perimenstrual period, so this is, see, these are all the managements you have to take care of during the intermenstrual period, that is between the two menses. And during the perimenstrual period, we have to go in for Rasna Sadamstradi Kashaya. That is one of the very effective preparation we have seen in our practice. Just three ingredients: Rasna, Sadamstra, Vishakai, and its Kshirapaka is very effective in this Udavartini, that too in the perimenstrual period. And Trivrit Sneha. Trivrit Sneha, the Sneha, there are two versions. One is Trivrit medicated in the ghee or oil, or the Yamakas Trivrito Maha, the three Snehas processed, Trivrit processed with the three Snehas. Vasam, Sarpis Thailam, Vasa, like that. And preparations like Kulatadi Kashayam, Rajapravatnivati, Saptasarang Kashayam, etc. we use in these conditions. And Erindadailam processed with Pushkaramola is also effective. So this is how we treat the cases of Udavartani. Here also you have to see whether there is a whole body involvement or it is limited to your this thing, Stanika. So then they are telling about the Patya. Udavrittaya Manupamamsam Rasam Kshira Svedo Dashamula Truvata Kalka Siddha Sneha Kalka Siddha Snehabana Manuvasana Uttravasti. These are to be done. Then we go in for the next disorder, Anarthava. Here it is characterized by the absence of menstruation. So if you want to understand what is the pathology behind it, you have to know the normal physiology. As per our things, the artava is a upadatu of rasa. Some say it is rakta, whatever it is. The formation of artava from rasa and rakta, it reaches garbhashaya, gets accumulated there, and when time comes, it flows out as the raja. So this is a normal menstrual cycle in just as told in our shastra. So this amenorrhea can be two types. One is physiological as well as pathological. So before menarche, what happens is, as the yoni is underdeveloped, the artava just circulates all over. Even though artava is formed, it circulates all only in the body, and as she attains menarche, it circulates in the body and the yoni. So that's why before menarche, she will not be having the menstruation. She will be having amenorrhea. And of course, after menopause, as the full body is in grip of senility, the integrity of the dhatu will be lost. So she will not be having adequate menstruation. And during pregnancy, the development of fetus obstructs the artava hasrotas. Thus, artava gets obstructed, and then it moves to nourish the breast during the pregnancy. So during the pregnancy also, as the artava has srotas is blocked, even though artava is secreted, Since Artha Srotas is blocked, so you will not get the periods. And next to puerperium, here the Artava is utilized for production of breast milk. The physiological conditions. Why it is called as physiological means it did not treat for this too. She does not need any treatment for this. Next condition which comes here is Bija dosha. In Yoni like Mandya, etc., as the development of Garbhashaya itself is affected, menstruation is absent. And when there is no Ashaya, there will be amenorrhea. And next one is injury to the Artavaha Srotas. If the Artavaha Srotas is injured, then the woman becomes infertile and will not be having the menstruation. So, in the Artha Srotas is afflicted, she may have the amenorrhea. And Rasakshaya. As you see, the Atma is developed from the Rasa Dhatu. Even though it is Rakta, it starts from Rasa Dhatu only. So, due to various diseases, exertion, Shodhana, etc., what happens is, when there is a debility, the formation of Artava, when the Rasa formation itself is reduced, the formation of Artava from Rasa will also be reduced, which will be leading to amenorrhea. Possibility of this is Artava Drushti. This Artava, which is formed from the Rasa, may get vitiated by the doshas. Here, the vitiation of Artava is by Vata Pitta, what we call this Vata Pitta Abhyam Kshiyate Rajaha. And in the diseases of Yoni also will get afflicted and it will produce amenorrhea. So what is the difference between the two is when the Artava comes to Garbhashaya, so Artava there is a I will see that later. Ashrayi Sambandham. The Ashrayi is Garbhashaya and the Ashraya is Garbhashaya, Ashrayi is Artava. When the Ashraya gets vitiated, it will vitiate the Garbhashaya. When the Ashraya is vitiated, it will vitiate the Artava. So both of them can vitiate each other to produce this amenorrhea. Either it may be a Sthanika indications which afflicts the Garbhashaya, it will inflict the Artava. And similarly, whether it may be the doshas which gets vitiated, inflicts the Artava, that vitiated Artava, when it gets into the Garbhashaya, will also inflict the Garbhashaya. And next one is Avrita Margatva, that is blockage of channels. So it is at two levels. One is at the yoni level. When the here Kapavata is said to be the blockage of the channels. And blockage due to, this is a whole body phenomena. Blockage of passages due to increased medas. When here in obese persons, as there is the meda gets increased, it spreads all over the body. The nourishment provided will be directed towards the direction, towards the development of medas alone, and not the other dhatus, as the rasa. Because what happens in Medo Dushta is, whatever nutrition you give, only Medas will be getting accumulated, natu itara dhatava. All the other dhatus as rasa will not be getting its nourishment properly. As they don't get the nourishment properly, naturally that will also lead to amenorrhea. So hence the formation of Atava is also disturbed, leading to amenorrhea. Then let us see in detail the management of amenorrhea. If it is Bija dosha, of course, physiological doesn't need any treatment, so we'll skip it up. If it is Bija dosha, it is congenital anomalies. As it is congenital, no management is advised. So injury to arthroscrotus, depending upon the nature of injury, management has to be administered. Where which part of it got injured, that has to be done accordingly. And then when it comes to resexia or general debility, treat the diseases which produces this condition, because there are two reasons why you can get resexia mainly. One can be due to the deprival of proper food, and in some diseases can also produce the resexia. Okay, like Rajayakshma, etc. There are certain diseases, or not only Rajayakshma, many diseases. At the end will be there will be an affliction in the Agni, which may lead to the resexia. So what you have to do is you have to treat the disease, whatever whole body disease that is involved in the formation of this producing the resexia, that has to be treated, and then the nourishment of artava will be regulated, and the artava will form, and it will start coming out again. And in the both the conditions of the both the condition, that is dushti, arthava dushti and diseases of the yoni, what happens is it is due to vata pitta, there will be a vitiation. If the arthava, in arthava dushti, the arthava gets vitiated by its reason and then it vitiates the yoni, whereas in yoni vyapad, the yoni gets vitiated by its reason and the arthava gets vitiated because they have a asraya asrayi sambandha. And the symptoms and line of management for both are almost the same. So such a patient will be presenting like this. The woman will be usually emaciated. Kasya Vaivarni Janani Brisham, usually emaciated, weak. He will find it difficult to walk, distinct, even to do her day-to-day activities. So normal noise, even the normal noise will irritate her, and this will be associated with amenorrhea. Then, so what you have to do is you have to go in for necessary Shodhana procedures, and then Amapachana is to be done. These are to be kept in mind, even though it is not told. You have Shodhana is necessary. You have to go in for that, and you have to go in for Amapachana should be done. Then you have to give Agneya or Ushna Dravyas for the induction of Artava, as Tila, Masha, curd, fish, etc. And preparations as Sura, Sakta, etc. are advised here. And generally in our clinical practice, we use preparations like Krishna Tilakvata with jaggery, Nashtapushpantakarasam, Kanashatahpadi Kashayam, Kulatadi. This should be Ushnavirya, that's very important. Kulatadi Kashayam, Kasisa Basma, etc. After doing that, you have to re-nourish the yoni. So you have to do a Brahmana. As we said in Jara, at the end you have to give the Grita to stabilize the Ashya. You have to go in for Brahmana treatment to stabilize the Ashya. There you have to give the preparations told us blood of various animals as goat, sheep, pig, egg, prepared with curd and amla dravya is to be given. Or you can give Brihat Shatavari Grita or Vidaryadigrita, etc., to stabilize the ashraya. Otherwise, again the samprapti may recur very fast. So at the end of the treatment, since the stanika dosha is vata, you have to complete your treatment with the brahmana at the end. And then comes the avrita margatva, or blockage of the passage. It's of two types, as we have seen. Blockage at the level of artava scrotus and garbhashaya, and blockage due to excessive accumulation of fat, medas, which is all over the body. For the blockage of artava scrotus at the level of garbhashaya, here the woman will be normal built, looks fairly well nourished. It will be anxious and feels heavy and cold, etc., associated with amenorrhea. She'll be almost a normal woman. So here we have to go in for usual Shodhana procedure, but it will not be, you don't need Amapasana and Shodhana very strong. So necessary Shodhana and Amapasana procedures are to be done. Here Amapachana plays a very vital role, for which we advise anabhishyanti diet, because here what happens is Just the srotas of that area is getting blocked. Here the ahara, just by regulating the ahara itself, in many cases we are able to re-establish the flow. So the Amapachana plays a very vital role, for which we have, there is an we you give the diet which is anabhishyandi, avoid all the abhishyanda dravyas, then naturally the woman will start menstruating with simple Amapachana drugs, Amatotram Kashayam and Shadharana Churlam. The menstruation will regulate. Because you don't need to go in for a very stronger Shodhana treatments. Just the proper Amapachana along with the Amapachana drugs itself will remove the blockage in the srotas, so that the woman will get, because here every other thing is correct. Only there is a small block in due to the kaphavata, which just by amapachana it itself will be able to manage that very comfortably. Usually with the simple drugs as amatotrangasayam and sadharanam, we will be able to resume the menstruation. But this is different. It is totally done similarly in medicines like Chitraka Grantyadi Kashayam, told in Gulma, Kanashatahvadi Kashayam, Saptasaran Kashayam, Pulingaramba, Kalyanakshara, etc. Also, we can use to initiate the menstruation. So, it will not need a very stronger medicines to do the medicines for the management. Next comes at the Brahmana. Then after doing that also, you have to do the end the treatment with Brahmana procedures as told above. Here we use Sukumarakritam or Palasarpis at the end of the treatment. So since it is a Vatikasthana, you have to complete the treatment with the Snehana, because treatment is a process. It is not a particular medicine, it is a process. That what we have seen in the first slide, no? So it is a process. Depending upon the stage, the medicines will go on change. So initially, at the end of every treatment, you have to treat with the Brahmana treatment. And next is the blockage of passage by increase of medas. Here the patient will be obese. The clinical feature will be like this. The patient will be obese with disposition of fat more in the hip, chest, and Saulya Lakshanam. All the Saulya Lakshanam we can enumerate in that woman. She will find all the routine works difficult and dyspnea and always prefers to lie down. So if this be the case, you have to understand it is due to the accumulation of medas. In those cases, when you do a just amabhajana, do those simple things will not help you. Then you have to go in for stronger treatment. As there is a blockage of channels due to Meda, Kapha, and obese, the Lakshanas of amenorrhea due to Marga Avarodha occurs here, and we have to treat for Sarvanga Medas, then only go for Sthanika Marga Avarodha. And here, like intensive Shodhana procedures, Udvartana is very effective. It's one of the important procedures to manage Staulya, and stronger Amapasana regimens. Nissukatvam Sukayacha, that you have to make him suffer to attain comfort. So here we use medicines which are Medohara, Kapha Medohara, like Varanadi Kashayam, Vyosha Chitragadi Kashayam, Punarnavadi Kashayam, Navaka Guglu, Varadi Kashayam, etc., which are little intense to take care of the Medas also. And after doing all these things, you have to complete here also you have to complete your treatment with Brahmana. But here what you have to do is you have to be very careful while giving the Brahmana, because the Brahmana treatment also is more prone for increasing the kapha. So you should be very careful that it does not increase the Meda and Ama. So with that, we complete the management of anarthava. So anarthava may be due to many reasons. That depends, which we have seen in detail in this till now. Next, this is what we are going to do is asrija. Asrija is raktayoni, which is characterized by increased flow of blood in the from the yoni. So they say that Rakta Pitta Karayanarya Raktam Pittena Doshitam Ati Pravartate Yonyam Labde Garbe Api Sahasraja. So here what you have to, the very with one word he gives the whole samprati. Rakta pitta karaihi naryaha. That is with those things, those nidana which are rakta pitta kara, what happens is raktam pittena dushitam. Rakta gets vitiated by the pitta, and that is characterized by ati pravartate yodnyam. It will be excessive menstruation is the presenting feature of this condition. And even though the woman is labdha garbha, even though she attains her pregnancy, then also she will have an excessive bleeding. So if you want to understand that, you have to understand this disease properly. You have to understand what Rakta Pitta is. That we will have a bird's eye view of Rakta Pitta also, so that we will have a clarity in approaching that disease. So kupitam pittalaih pittam dravam raktancha murchite te mitastulya rupatvam agamya vyapnatastanum pittam raktasya vikrutehe samsargat ushmanadapi gandha varnanuvriktesya raktena vyapadishyate prabhavati asudhyasthana tikruto pliho ekrutasya tat. So what happens is Pittalaihi, the Vitta, gets vitiated by its nidanas. What will happen is the Dravatva Swarupa of the Pitta increases. And this Dravatva Swarupa, when it gets mixed with the Rakta, te mitaha tulya rupatvam agamya, and it circulates throughout the body. And since here what happens is, even though the Rakta is red, by the addition of pitta, the quantity of rakta increases, but it is a dushta rakta. So what happened is, since the pitta is similar to that of rakta, it is called as rakta itself, and when the time comes, it comes out of its sthana. So what you have to understand is the dosha which is there in the root is pitta, and it is characterized by the excessive flow of blood. In Raktapita, it comes through various orifices like Urdhvaga, Adhoga, etc. That all you know. So, in Raktavarnayoni Chikilsa, what they say is Raktayonyam Asragvarnaihi Anubandham Samikshacha Tatah Kuryat Eta Dosham Raktastapanam Aushadam. They say only that sloka and second this sloka. So Asrak Varna Anubandham. From the Asrak Varna, you have to see the which dosha is involved. That you can see from the Raktapita Nidana, as also in the Rakta Mokshana chapters also they explain the what are all the changes that comes to the Asrak due to the various vitiation of doshas. So Rakta Stapana Mokshanam, you have to give with that they bluntly leave. So let's have a look into the Raktapita Chikitsa. It's only one sentence they have given for the management of that, which will not be sufficient to manage it clinically. So if you go into the Chikitsa of Raktapita, Nyatva Nidana Mayanam, Malam Anubalobalam, Deshakala Devastamcha Raktapitte Prayojabil, because Raktapitta also has got various stages. And depending upon the intensity of the dosha, what is the Anubandha dosha, you have to do the treatment. What are the treatments you have to do? Langanam, Brahmanam, Vaado, Shodhanam, Shamanam. So you have to do Langanam, Brahmanam, or Shodhana or Shamana. So in Vyakhyana, what they say is Santarpanottam Balino Bahudoshasya Sadayeta Urdhvabhagam Virekena Vamanena to Adogam. Because Urdhvabhaga is associated with Kapha, and since it is Santarpanota and Balina, if the Rogi is Balina and Bahudoshasya Sadayeta, and if the dosha is also vitiated, Urdhvabhagam Virekena. If the what we have seen in the first, the Shodhana procedure, when the Utklishta Avastha, you have to go in for the Utklishta Avastha, you have to go in for the Shodhana. And how you have to do is Shodhana is Urdhvabhagam Virekena. If it is the Urdhvabhaga, you have to go in for Vireka. And if it is Vamana, you have to do Vamana if it is a Roga Raktapita. So if the dosha is Utklishta and it is coming to the Adobhaga, you have to do Vamana. Why? Because of the very nature of the Because in Vamana and Virechana, we induce or we force the Vata to take a particular direction. In Virechana, we make the drugs will make the Vata to get it down, whereas in Vamana, it makes the Vata to push its contents up. So by here, when you do, since it is Vata and it is flowing out, first thing you have to do is the problematic part is the gati of Vata is very important. So you have to reverse the gati of the by doing the Shodhana procedure, which is quite opposite to that of the flow of the Rakta. So Urdhva Bhagam, if the Urdhva Rakta Pitta, you have to go in for Virechana, and for Vamana, you have to go in for Vamana in Advaga Raktapitta. And Shamane Brahmana Shanyat Langanam Vangya Brahman and Avekshitat. Here what they say is Urdhva Bhagam Shamanaihi, Adho Bhagam Brahmanaihi Upacharet. That is the Vyakyana. That is, if it is a Urdhva Raktapitta, you have to treat with Shamana Dravyas. Why? Because it is associated, Anubandha dosha will be Kapha. Whereas it is Adho Bhaga, you have to go in for Brahmana. So since Rakta Yoni is a Adobhagaja Roga, you have Brahmana plays a very important role. Urdhvam pravritte shamanau rasahu tikta kashayakohu upavasasya nishunti sharangodaya paninaha. That is, if it is associated with what is it, Urdhva Rakta Pitta, you have to go in for Tikta and Kashaya, because you have to treat it with Tikta and Kashaya rasas, and also Upavasascha, because it is Kapha Pradhana, Upavasa also has a role, and you can go in for a Nishunti Shadangodaya Panilaha. That is, you have to take the drugs without Shunti in the Shadanga, which is told in the Jara Chikitsa. Actually, when we look, if you want to understand properly the Dravya Guna, you have to see where the drug has been particularly understand the property of the drug. You can understand from where the drug is proper utilized there. Actually, the Shadangapana is indicated in the Jara, where it is indicated. So first in the Jara Chikitsa, they ask you to give Ushnambu, and in condition, if it is a Paitika, if the disease is Pitta Pradhana, there you cannot give Ushnambu, there you have to go in for Shadangapana. What is the significance of Shadangapana is Gana Chandana Shuntyambu, Parpata Ushira are the contents in that. And on this, except Shunti, all the other drugs are Shita Virya as well as Amapachana. And Shunti is Ushnavirya, but since it is in Madhurapaka, it will, and there in Jwara, the Shunti, the Ushnatva of Shunti is essential to catalyze the Amapachana. Whereas here in Rakta Pitta, what happens here also, it is Kapha Pradhana, but if we, and the disease by very nature is Pravartaka Swarupa, the disease, things are flowing out, and even the small Ushnatva of Shundi will increase the flow. So that's why they say Upavasasya Nishunti Shadangapayana, except Shundi, you take the other 5 drugs and prepare the Pana and take. So the drugs are used with such utmost careful considering the condition of the disease. So here you have to give Nishunti Sharanga Painaha. Then this is important. The next line is important for us. Adhoge Raktapetechu Brahmanam Madhurorasaha Urdhage Tapanam Yogyam Prakshapeyam Adhogade. So what we get is we have to do Brahmana is important in Adhoga Raktapita, and we have to go in for Peyadikrama as it is in the Adhiksa Adhogate. And one more important principle you have to learn is Ashnato Balino Ashuddham Daryam. If the bleeding is if the bleeding is Ashuddha, if the Rakta Dushta is very high, you should not block, you should not do Stambana, because Tadhi Roga, that itself will vitiate the Roga. So, but there are 2 important conditions that you have to keep in mind. Ashnato, he should be eating Nalla chapter, he should be having a Balavan. He should having the Sharira Bala and Dhatu Bala should be good. Otherwise, because bala is very important in the treatment of any disease. So, Dari, because if you don't do it, uh, because if you allow the blood to flow in Abala Rogi, then it will be Shigra Agnivat Shigra Kari, that it will kill that patient. So if the patient is Balava, and if the flow, if you allow, if the Rakta Dushti is high, then you can allow the blood to flow through, and then try to stop it when the dosha subsides. Otherwise, what will happen is, if you do the stambhana in the initial phases, when there is when there is dosha still, Rakta is vitiated highly, then by doing the stambhana itself, the process will be increasing. And here also you get the same procedures like Shodhana and Manta, Peya, Kashaya, etc. are explained in the Raktabheta Chikitsa. And then Kalpayet Shita Vargancha, Pradeha Abhyanjanadishu, Etcha Pitta Jaroknam, Bahirantascha Beshajam, Raktapitte Hitam Tashak, Shatakshinascha Hitam. These are all the things you have to follow. So here they say, Kashmirya Kudajakwata, Siddham Uttaravastina, Raktayon Narajaskanam Putragnasya. They are telling only this Krita they are mentioning in the Chakarjaraka Samhita. Jatagni Raktayonisya Raktakshayasu Kutaja Kashmiryakwata. Then here what we do is, generally if it is a Raktayoni, initial phases, if it is associated with Ama, you just do a small amount of Amapachana. By Amapachana itself, usually it will subside, it will get reduced. Then if we see that the Shuddha Rakta is going out, then we hardly have to go in for Stambhana Chikitsas. And here the Vasa Prayogam, the Vasa Swarasa is one of the very important drug which have found more successful in many cases, because it is said that Vasayam Vartamanayam Ashayam Jivitasya cha Raktapitti Kshayikasi Gimartam Avasidati. Just the administration of Vata Swarasa every morning or twice a day will help to reduce, and Vata is great cause and Vasa Guruchadri Kashayam, Ushiradi, and condition Kushma.
So you are not audible. Hello. All the participants are requested to wait for 5 minutes.
कितने लोग जुड़े हैं अब इसमें? 100 जुड़े कि नहीं जुड़े?
हाँ जी सर, हाँ जी सर, हैं 100 तो। All the participants are requested to please wait.
डॉक्टर साहब बड़ा सुंदर प्रस्तुति कर रहा है भाई आपका।
सर उनका शायद कुछ नेटवर्क का इशू है, तो उनकी साइड से लीव हो गया है, तो अभी वो ज्वाइन कर रहे हैं।
उपसंहार बता दें यार, थोड़ा उपसंहार बस खत्म क्या
From
है।
where it is, when you missed it? From where you have missed it, sir? Is it now audible?
हाँ जी, यस सर, ऑडिबल।
So from where you have missed it? What was the last slide you missed it? Can you see? Have we got this?
सर यस, रक्त योनि चिकित्सा।
Okay, that is over. No, that was audible, no? Last before closing.
Yes sir, that
That
was
was
audible.
completed. No, that was completed, no, previously before cutting. Okay. So then we go in for the next yoni vyapath. It is upapluta. That is, it is a kapha pradhana yoni vyapath. So garbhinya shleshmalabhyasa sardi nishwasa nigrahat vayih kruddam kapam yoni upaniya pradoshayat pandum. It is characterized by pandum satodam asravam. It is characterized by whitish discharge, which is a common condition which you get in your day-to-day practice. Kapavatamaya vyapta sasyat yoni upapluta. Pluta means covering or immersing the yoni with kapha. So we call it as upapluta. So we have here the line of treatment will be you have to treat for the kapha first with the like that of kashayas like musli kadaradi, even the pushanaka churnam, lodra kashayam or madhu or lodrasam, etc. And they have to go in for Kshalana with Tripalakvatam or Aragvadadi Kashayam. And as the Sthanika dosha is Vata, treating only Kapha will not be sufficient, and hence at the end you have to do Sneha Prayagas to conclude the treatment. So the treatment has got this is what I want to highlight. Even though it is a kapha pradhana vyadi, since the sthanika dosha is vata, you have initially have to treat for kapha and remove the kapha. Once the kapha gets subsided, then you have to go in for a sthanika dosha treatment or vatahara treatments and or brahmana treatment to stabilize the ashra. Otherwise, the disease will be recurring. Here only they have told the Datakyadi Tailam. The Datakyadi Tailam is the Kapaharatva Tailam, and it has to be used at the end. So first you have to go in for Kshalana, etc. Then you have to go in for Pichu like that of Datakyadi Tailam. Then next comes the Mahayoni. The speciality of this you have taken is because the yoni itself has prolapsed out. Vishamam dukkashayayam maitunaat kupito nilaha garbhashayasya yonyasya mukam vishtambhayet sriyaha asamvritamuki sarti ruksha penasra vahini mamsotsanna mahayoni parva vanshana shulini. So what happens here is dushto vishtambha yoni asyaha garbhakostam cha maratah. That is vayu getting vitiated. It afflicts the yoni and it makes the mouth of the yoni vivrita, and what the clinical feature will be utsanna mamsam, and it's called tamahu mahayoni maharujam. It's called as mahayoni. It's just the prolapse of the uterus. So here, why this is how we have to take in for the management of the Mahayoni. Why you have first thing concept what you have to keep in mind is Yonihi sthanapavrityahi shalyabhuta matastriya. The yoni which has come out of its sthana is to be treated as a shalya. Shalya is the one which has to be removed. Isn't it? It's a foreign body, but if it is to be replaced in its sthana, the shalyatva property will go. So what you have to do is you have to try to replace the yoni in its particular sthana. For that, what you have to do is snigdha svinnam tata yonim dustitam stapayet punaha. You do a sneha svedana and replace the yoni. That is, if it is whatever be the shape, you do an opposite movement and replace the yoni in its sthana. So after doing the replacing the yoni, you have to go in for yoni purana. Like Vasariksha Varahanam Grutancha Madhuraihi Purayitva Mahayonim Badniyat Shauma Alaktakaihi. You have to go in for Purana with that of Vasariksha Vara, the Grita or Madhurausada Siddha preparations. And you can go in for Kukuta Mamsa or Kulira Mamsa are to be or used here. And the very and then they explain that Prastastam Sarpisham Abhyacha Kshirasvinnam Praveshyacha. That is, after when the yoni has come out of its sthana, you do the Abhyanga and do the Kshirasvedana. That is, with the Kshirasvedana you do and replace it in its sthana. And then you have to apply Veshavara Pindena Amutraka. You have to apply Veshavara. They call this Veshavara Dharana. It is a preparation which is made out of Mamsa. So we have to apply that Mamsa and replace it, refill the yoni and do the Bandhana, Goshpana Bandhana, and retain it till the Amutra Kalataha. Till the Amutra Kala you have to retain it. So by keeping this usually, and you have to treat for the stabilizing the Ashaya and etc. and all Vatahara treatments you have to be done. And then by that we will be able to, the yoni will get replaced in its sthana, and Vasti and Vatahara Ahara Viharas are to be done, and Lagu Palagritam is found to be effective in this. In fact, the Shveshavara Dharana is one of the very effective practice we experienced in this context. With that, let me thank you for giving this opportunity once again. And if you have any queries, then I'm happy to answer you.
If anyone is having any doubt, then please ask.
डॉक्टर साहब बहुत सुंदर व्याख्यान रहा है, आपका बहुत बहुत बधाई।
Thank you.
Sir, in case of uterine bleeding, any Adyatika Chikitsa?
So first thing, you have to see whether the line of management is, if it is very dosha yukta, that is dosha yukta, you just by doing amapasana itself it will subside, because we have seen in many cases those are refractive even to hormones and all the conservative stambhana dravyas respond very well to the amapasana chikitsa. This by doing anavashyadi diet with things like Vasa Swarasa or Guruchadi Kashaya, we have seen that stop. And if it is, the bleeding is Jivita Rakta, we will be able to do the Stambhana with that of preparations like Laksha and Pushyanaka Churna, etc. So that we have to keep in account about the health of the patient also. That's very important. Bala of the yogi has to be considered. If it is emergency, if it is very weak, means then you have to resort to other modalities so as to maintain her stop the bleeding.
Sir, can you repeat the dosage of Vaswara, sir?
We usually here give 20 ml twice a day. 20 ml of
Twice.
Vasa Surasa with 1 teaspoon of honey.
How many days, sir? Till the
Usually,
symptoms.
actually, we have seen, we used to give for 1 week, you are 10 or 15 days because it's easily available now. So we give them usually 1 week or 10 days, we can continuously give. And even in absence of this also, absence of bleeding also, you can continue that even for 1 or 2 cycles. In some cases, we have given it for 1 or 2 cycles even. That we have found it gradually all the hormonal imbalances were also getting regulated with that. But before that, we
Actually,
have to ensure that it is a Raktapita.
sir, actually, I'm treating one patient, sir.
Mm.
She has a continuous bleeding every 15 every month. She will be bleeding around 15 days with clots.
Mm.
She has no issues of PCOD or thyroid or any gynecological issues. I have
Mm.
given her one course of Virechana followed by
Mm.
medicines.
Mm.
That time it was subsided, but again this cycle she started bleeding for again 15 days, sir. It is
So
not
this is the
subsiding.
problem. That's what I told you. No, it is a Raktapita expressing as the through the yoni. Raktapita coming out as a Rakta yoni. So you have to treat for the whole
Vamana
body.
Kiyan.
For this, no, not one thing. Vamana, you not consider that
Mm.
type of this thing because it is only if it is flowing continuously for many days, then only you have to consider Vamana. Because it is
Okay, sir.
only during the period she is having, no? So the dosha vitiation will not be that high. So Shamana Prayogas, as you do for Raktapita, in this Vasa Prayoga will be very effective. You continue the Vasa Prayoga for a month or two. She'll completely be recovered. If at all there is any other comorbidities like organic lesions, Vasa Prayoga is a very, very effective this thing treatment we have experienced.
Yes, sir.
You can
Thank you, sir.
continuously for 15 to even at 2 or 3 cycles. In half, we have the case of this factor XMS factor deficiency. Those patients he used to hemophilia. Since he was a poor patient, I just asked him to continue for Vasa Suras Vasa. But usually the presenting complaint was whenever he had any hit, that hit will become swelling, etc. So it will become the bleeding will be continuous. He has to go in for a vitamin K to stop all these things. But that patient was asked him to take Vasa Surasa continuously. It took for somewhere around 6 to 7 months, and after that, the symptoms, even the blood picture was bleeding time, clotting time, everything has resumed to normal. But with one case, we cannot establish anything. But it is my clinical experience. So Vasa in Raktaja Vika, especially in Rakta Pitta and Raktaja Yoni Vyapat, Vasa is Prayoga is very effective one. But we prefer to give with the Swarasa because it's cheap, easily available.
Yes, sir.
Sir, that Vina Shunti Shadangapaniya, from where you taken and can I have more information regarding that, sir?
Pardon? Yeah. So the Shadanga Paniya is
Shunti Rahita Shadangapani.
Nishunti Shadanga. See, Shadanga is a preparation told in the Jwara. Isn't it? The Gana, Chandana, Shunti, Anbu, Parpata, Ushira, Saditam. This is the formula for Shadanga Paniya. In Jwara, why they include Shundi is because you need an Amapachana. For Amapachana, the Ushnatva of Shundi is essential. But since the patient is suffering from Paitika, Paitika Avastha, in the Jwara, which is Pitta Pradhana, you cannot give a Ushnambu. Instead, you have to give this Shadangapaniya. So this Ushnatva of the Shunti will not increase the Pitta. Why? Because it has in the Vipaka it becomes Madura. Okay. So in that Jwara it is because since Amapachana is the main target, we use this in the Jwara. Whereas in Rakta Pitta what happens is all the other drugs except Shunti Gana, Chandana, etc., all are Shita Virya and Amapachana with the contrast properties. So that we need. Whereas since the Rakta Pitta, since there is a flow, what happens is the flow of Rakta, even that small Ushnatva will increase the flow of the blood. So that's why they say you don't use this. You remove the Shunti and make the other 5 as the Kashaya and give. This Shunti Sharanga in the Rakta Pitta Chikilsa. Kapapradhanaka Rakta Pitta Chikilsa.
Is it in the form of Kashaya, sir?
We can give as a Paniya or Kashaya. You can give it as a, ask them to put it as a make as a drinking water, ask him to drink that water, or you can give it as Kashaya also.
Thank you, sir. Sir, can we have some words regarding PCOS?
Regarding?
PCOS, sir. PCOD.
Sir, so I just want to confine myself based on the classical Ayurvedic approach. Actually, this has been explained very well in the this. See, there is a while treating amenorrhea, there are 2 stages. I have told you, Margavarodha in the Sthanika and Margavarodha whole body. These 2 things will the clinical features of PCOS will shifting between these 2 things. So initially, what we do is we have to focus more on the Amapachana. First, Amapachana plays a very important role. After doing the Amapachana, if the patient is obese, then because we have to go in for the whole body treatment, Medo Dushti Chikilsa. Otherwise, you have, even if it is Medo Dushti is not there, if the other, because in PCOD there will be a weight gain, all the other features like hirsutism, etc. will be there. No, those conditions we consider it is due to the excessive medas, where it warrants stronger clinical interventions like Shodhana, stronger Shodhana, longer Shodhana, stronger Shodhana has to be done. Whereas if it is just usually the woman is normal built. So, see, PCOS is only a condition. The clinical presentation is very important to us. If the patient is normal built, because in the initial stages of PCOS, you get features like that. They will have a normal cycle. Suddenly, they will have an amenorrhea for 3 months and have an excessive bleeding. But those things will not be reflected in the body of the patients. Like if she will not be obese, or other features will not be seen. In those cases, if we go in for just an anabhishyandi diet, remove all the abhishyandis which are mentioned in our Shastra, then put her on a diet itself with a small Amapachana, things like Amurdatra Kashayam and Shadharana will initiate menstruation. Otherwise, what happens is, if it is not responding, then you have to resort to the next line of treatment, like going for the Medoharana. After doing the Medoharana, usually the thing resumes. Because we cannot exactly correlate PCOS to one. It depends upon the clinical presentation we have to consider.
Can we take it as a Artava Dushti, sir? Whenever we are using our treatment modalities for insurance, what must be our diagnosis?
Pardon, I can't get you.
I want to.
Pardon?
Sir, we have treated a patient for PCOS. Now they are asking for insurance. In that diagnosis, what must be our Ayurveda term?
Which one? PCOS.
For PCOS. For PCOS, PCOD.
No, I don't know. I don't know what is the exact translation for that. We just treat based on the symptoms, sir. Because we cannot correlate all the diseases exactly. So this is what happens now. So PCOS is a disease which has got various stages. And what we have to treat is depends upon the stage we give the medicine. Okay. So labeling, we don't go behind the labeling. We go behind the the dosha and the dhatu dushti which is involved in the disease. So to be frank enough, for PCOD, I don't know what there are many correlations. I don't know what insurance people will accept or not. I don't know. That we have to check with the concerned authorities, sir.
Thank you, sir.
On behalf of organizing committee, I would like to thank Dr. S.N.Suresh sir for delivering such an insightful lecture. Thank you, sir. Thank you so much. I would like to extend my sincere gratitude to our mentor, Vaidya Devendra Trigunaji, President GBRAV, for his continuous support, guidance, and blessings. I thank our director, Dr. Vandana Siroha ma'am, who is the guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Koteja ji, Secretary Ministry of Ayush, for his participation and encouragement in all our endeavors. Most importantly, I would like to express heartfelt thanks to all the gurus, shishyas, and other scholars who, with their presence and active participation, make their webinar successful. Thank you. Namaskar.
Namaskar.